Good afternoon, everybody. My name is Chelsea. I am the team leader for the Sudbury and North Bay districts for the PATH and My Way Home program. We are very excited to speak of our Northeast CSS Bundle Care ALC initiative, My Way Home. What is My Way Home? My Way Home is a time-limited up to 6 weeks regionally funded program that supports clients by offering a bundle of CSS services, an enhanced coordination role to navigate our system. We remove financial barriers to clients who may not be able to access these vital services. The initiative is designed to reduce ALC patients in the Northeast while supporting ED diversions and admission adversions. The goal of this initiative is to support clients by offering an enhanced coordination role to navigate the system and services, as well as remove financial barriers to those who may not currently be able to access these vital services. We believe that the My Way Home program has and will continue to make a big difference to the quality of care available in the region, and ultimately it will lead to better outcomes for patients. How does My Way Home support clients in the community? Well, as seen in the graph here, the historical continuum of care has been confusing and shown to be at times inaccessible. Examples would be financial barriers, duplication in the referral process, or lack of knowledge in the services available. There are multiple sources coming to the clients at once, which can be very overwhelming for the client. So as shown here in our new graph, the My Way Home program aims to coordinate access to multiple CSS services with no financial barriers, supporting the client throughout their journey and creating a more cohesive continuum of care. So who is eligible for the My Way Home program? Clients who are 55 and over, or adults with physical disabilities. Clients must be in need of more than one eligible service, does not live in long-term care home, in need of financial support for services, and have recently been discharged from hospital or AD, or at risk of presenting to the hospital from community. Services included in the bundle of care are care coordination functions, system navigation, meal services, frozen or hot, transportation, and wellness checks. Services are provided based on internal assessments and determination of what the client will require. Services can include up to 6 weeks, given the consideration of the client's plan. It's important to note that the type of meal services available is based on what options the provider offers in that area, and consideration will be given for other supports or services the client may require based on the individual needs. The referring agency role is as follows, and this can be anybody from HCSS, discharged hospital planners, HSPs, self-referrals, family physicians, nurse practitioners, anybody from the circle of care. You would identify the client from the My Way Home program, and you would complete a referral for the My Way Home program using CareDove. If you would like to become a network referrer on CareDove, please contact the Innovation Center, and a contact can be found at the end of my slide. It's important to note that when referring a client and explaining the program to the client, please advise that the services offered are based on our internal assessment findings. The lead agency role is as follows. We receive, review, and ensure eligibility of the referral. We complete our assessments using the InterRise suite of tools and internal assessments. We determine and arrange required services. We coordinate and engage with partners. We provide care coordination throughout the 6 weeks time frame. And we arrange the billing between service providers and the regional funder. And we work with the Innovation Center to report on metrics and data. The role of the HSP. So eligible clients from My Way Home will be referred to HSP partners by the lead agency using CareDove. The referral form will say if the client is a My Way Home client, and we will be sharing all assessments with providers as required, including our InterRise suite of tools. We will collaborate and communicate with lead agency if client needs changes, and the HSP will invoice the lead agency instead of the client, and support and provide services to the clients as usual. One of our first clients into the program came to us from the hospital. My Way Home was made aware that there was a note left on the chart that was concerns for his environment and safety, although no more details were able to be provided at that time. It was time for the client to be discharged home. So a discharge was coordinated with the My Way Home staff, and clothing was provided to the client. My Way Home drove the client home, and upon arrival it was noted that the home was unfit for the client due to clutter. The client had not been able to do laundry in months. There was a mountain of laundry seen all over noted on the floor. They had no clean linen or clean clothes left. The garbage was seen all over the apartment as he was unable to bring his garbage out due to weakness. The nutritional needs were being unmet which had been a factor in his hospital admission. The client was diabetic and was accessing the food bank. Unfortunately, the food bank did not have the means to provide the client with the nutritional requirements he had. The client was at risk of eviction due to the state of the apartment and complaints from other tenants. The landlord had advised the coordinator working with the client at the time. Meals were brought to the client and brought to his home. Extra staff came over and helped take out the surface garbage for the client and ensure he had room to go from his bedroom, his bathroom, and kitchen until more could be done. Unfortunately, a couple of days later, the client was back in hospital due to a medical condition. He had found his kidneys to be in failure. The My Way Home team advised the hospital staff that the home condition and things had to be done before he was discharged again. The client lived on the outskirts of town, and this posed a few challenges to the one working with the client. Although Red Cross My Way Home program rolled up their sleeves and got to work right away. My Way Home staff visited the client in the hospital and spoke to him about his home and services My Way Home could help with. The client consented to My Way Home to keep working with him while he was in the hospital, and he provided his landlord's information and his address to his home concerns. My Way Home reached out to service providers in the community and coordinated a professional cleaning services. A lot of hours went into this, with many trips to landfill, storage facilities, and manpower to get the home clean and safe. In the meantime, My Way Home coordinated with HSPs for meal services and transportation services to ensure the client was able to meet his nutritional needs and medical appointments going forward. The day had come for the client to come home, and the client was speechless about what he came home to. A lot had been done, but My Way Home's work was not done yet. Now that the client was home, we had to ensure his stay home would be long-term. We coordinated with ODSP to have the client reevaluated in a food allowance to ensure he can continue to pay for the meal service beyond My Way Home's length of stay. We assisted the client with subsidy application for his transportation needs and coordinated with HCSS for home care services. To this day, the client has not returned to our services and has been attending his medical appointments and meeting his special diet and nutritional needs. This was the first of many cases for My Way Home, and our work has only started. As mentioned in my previous slide for our first My Way Home clients, there was a lot of things going on. We had a lot of work to be done, and there was a lot of factors that played into it. A lot of HSPs were involved, and a lot of collaboration was made for the client to be successful. Here are some things that we can think about. What can My Way Home do for your clients? If you've ever had thoughts of, my client will need help, but we don't know what services yet. Assessments are required. My client can't get to appointments. There's concerns of post-discharge, some social isolation, there's no support, financial barriers. If these have been any of your thoughts for your clients, My Way Home can help. And although there are many items listed above, please contact our staff for anything above and beyond this list, and we'd be happy to help. And as we come to an end of our small information session on My Way Home, other services offered by Acadian Red Cross in the Nipissing districts are as follows. We have our PATH services, which is our hospital to home discharge, our seniors transportation, friendly calls program, and emergency management. Thank you, everyone. Merci, miigwech. If you have any questions regarding CareDove or how to send our CareDove referral for My Way Home, please contact Megan at the Innovation Center. I have included her email here on the slide. If you have any questions at all regarding My Way Home or PATH, please do not hesitate to send me an email, and I will be happy to answer all of your questions. I will get back to you guys as soon as possible, and I hope that everybody has a wonderful afternoon. Thank you.